This is the Coronavirus Daily Briefing for Tuesday, March 10th, 2020. I'm Brian McCullough. Harvard asked students not to return to class. Oregon is running out of tests. We still don't know how many people have been tested in the U.S. On-the-ground reports from the situation in Italy. Our best guess for the incubation period for the virus, and why soap is actually pretty darn good at combating the virus. As of noon Eastern, more than 114,000 cases of COVID-19 have been officially reported globally, and more than 4,000 people have died. More than 700 people in the U.S. have tested positive for the virus, and 26 have died. New York State has reported 140 confirmed cases. The state of Ohio confirmed its first cases yesterday, all in the Cleveland area. 30 states and Washington, D.C. now all have confirmed cases. The Harvard Crimson is reporting that all classes at Harvard University will move online beginning March 23rd. The university has asked students at Harvard not to return from spring break and only attend classes for the rest of the term virtually. Students will be required to move out of their Harvard dorms by March 15th. The Oregonian newspaper is reporting that the state of Oregon's supply of coronavirus tests could run out by tomorrow if the state does not receive new tests from the federal government. The state had about 130 tests remaining as of Monday night, enough to test around 65 people since it takes 2 tests per person to make a diagnosis. Quote, state officials say they are confident more enzymes, a critical component of the tests, will arrive from the Centers for Disease Control and Prevention on Tuesday and Wednesday. If and when that happens, state officials say they will have the capacity to test about 4,800 people. I have a high level of confidence these tests will arrive, said Dr. Dean Seidlinger, state health officer and epidemiologist, end quote. The state of Oregon had originally received 1,500 tests, so that's an indication of how fast you can run through these things. Italy has put the entire country on lockdown. More on that in a coming segment. The president of the European Parliament is self-quarantining after spending a weekend in Italy recently. Infections have topped 1,000 in each of France, Spain, and Germany. And Iran is officially reporting that cases there have reached 8,000. And just as we were heading in to record today, New York Governor Andrew Cuomo announced he would be deploying the National Guard to New Rochelle, New York, where initial cases of coronavirus originated, quoting NBC4 New York. Measures include deploying National Guard troops to a health department command post and setting aside a satellite testing facility and 1-mile containment area in the city. To date, Westchester County has seen 108 confirmed COVID-19 cases. That's 58% of all tri-state cases. New Rochelle is home to the Midtown Manhattan lawyer who has been linked to dozens of cases across multiple states. He was the second confirmed case in the state and its first instance of community spread. There have since been fresh instances of community spread, including New York City, which Cuomo said added more than a dozen new cases overnight. Overall, the state of New York sits at 173 confirmed cases, trailing only Washington State, 179, as America's most impacted state, end quote. We still don't know how many people in the U.S. have been tested for the coronavirus thus far. Health and Human Services Secretary Alex Azar admitted late Monday. Why that continues to be the case is a mystery, as knowing the true state of what's out there might be important. The CDC removed the number of Americans tested for COVID-19 from its website back on March 2nd, and it doesn't sound like it'll be back anytime soon. Quoting from the Washington Post, in a White House news conference Monday, Azar said officials didn't know how many tests had been administered because many people were tested at hospitals and private labs, and the technology infrastructure to report those results directly to the Centers for Disease Control and Prevention is not yet up and running. Azar said the CDC is, quote, working to build IT connectivity with them, end quote. Right now, I could not give you a number of how many Americans have received a test, Azar said, end quote. Secretary Azar did say that more than 4 million tests would be available by the end of the week. Again, the concern is that if the lights aren't on soon, as was the quote from a previous episode, then we won't know the true state of affairs anytime soon. Word out of South Korea is that the number of new cases there is declining. Only 35 new cases were reported this morning from South Korea in their morning update. 131 new cases over the past 24 hours. That's compared to 909 new cases in the 24-hour period on February 29th. South Korea seems to be turning a corner. But then, according to Business Insider, on a per capita basis, and these numbers are from 24 hours ago, South Korea has tested 3,692 people for every 1 million residents. Italy has tested 826 people per 1 million residents. The UK has tested 347 people per million residents. The US has tested 5 people per million residents. Italian Prime Minister Conte has placed the entire country in a state of lockdown as the number of coronavirus cases has exploded. As we noted on yesterday's show, Italy saw enormous growth in the number of cases over the weekend, with total cases now at 9,172 and total deaths at 463. Cases have been confirmed in all regions of the country. The new restrictions affect Italy's entire population of 60 million people. Quoting from the Washington Post, with the latest moves, which take effect Tuesday and remain in place until at least April 3rd, Italy is upending the last vestiges of normalcy, ensuring a bruising recession and testing the limits of what a democracy can do during peacetime. Italy's hope is to cut off its citizens, no matter where they live, from most kinds of travel, including abroad and from one region in the country to another. Italians will be permitted to travel only for essential work, health reasons, or other emergencies, end quote. Summarizing the measures as stay at home, Prime Minister Conte told La Repubblica, quote, "The numbers tell us that we are having an important growth of the infections, of the people hospitalized in intensive and subintensive care, and alas, also of the deceased people. Our habits therefore must be changed. They must be changed now. I decided to take even more stringent measures immediately," end quote. The new measures went into effect this morning. Bars and restaurants will close nationwide at 6 p.m. Schools and public events will be off limits until April 3rd. Even the Serie A soccer championship will be stopped. Conte added, quote, "We can't afford to let our guard down. It's time for responsibility, and we all have it. You citizens, all with me. The right decision today is to stay home. Our future is in our hands," end quote. As mentioned yesterday, the concern is that Italy might be a guide as to what is in store for other countries. Clearly, in Italy, by the time authorities were certain there was a problem, it was too late. And one has to wonder what is really going on the ground at this moment if a country is willing to shut down completely. That is unprecedented. I hesitate to share personal anecdotes of what it's like on the ground for fear of hoaxes and whatnot, but here are two that I see no real reason not to believe, and I'd rather try to get a sense of what's happening in real time rather than wait weeks to find out after the fact. First, there is an article from L'Eco di Bergamo. I apologize for any bad pronunciation there. A newspaper in Italy which claims has a transcription of a Facebook post from a Daniele Maccini, a doctor on the front lines in Italy. Put it through Google Translate yourself, but let me quote from a few different sections stitched together. Quote, "The situation is now nothing short of dramatic. No other words come to mind. The war has literally exploded and the battles are uninterrupted day and night. One after the other, the unfortunate poor people come to the emergency room. They followed all the indicators given, a week or 10 days at home with a fever without going out and risking contagion, but now they can't take it anymore. They don't breathe enough. They need oxygen. One after another, the departments that had emptied are filling up at an impressive rate. The display boards with the names of the sick, of different colors depending on the operating unit they belong to, are now all red. And instead of the surgical operation, there is the diagnosis, which is always the same, cursed: bilateral interstitial pneumonia. And there are no more surgeons, urologists, orthopedists. We are only doctors who suddenly become part of a single team to face this tsunami that has overwhelmed us. The cases multiply and we arrive at the rate of 15 to 20 hospitalizations a day, all for the same reason. The results of the swabs now come one after the other, positive, positive, positive. Suddenly, the emergency room is collapsing," end quote. And I do want you to be healthily skeptical of the second one because it is a secondhand personal anecdote. But Jason Van Shore's Twitter account says he's a registrar in anesthesia and ICM, NIHR UCL academic clinical fellow in London. In his tweet storm he posted last night, he says he is relating a conversation with an intensivist and accident and emergency consultant who is on the ground currently in northern Italy. This colleague, who Van Shore doesn't identify, says that hospitals in Italy are currently running at 200% capacity. I'm going to quote from two different sections here. Quote, "We've stopped all routine. All ORs have been converted to ITUs, and they are now diverting or not treating all other emergencies like trauma or strokes. There are hundreds of PTs with severe respiratory failure, and many of them do not have access to anything above a reservoir mask. Patients above 65 or younger with comorbidities are not even assessed by ITU. I'm not saying not tubed, I'm saying not assessed, and no ITU staff attends them when they arrest. Staff are working as much as they can, but they are starting to get sick and are emotionally overwhelmed. My friends call me in tears because they see people dying in front of them, and they can only offer some oxygen. Ortho and pathologists are being given a leaflet and sent to see patients on non-invasive ventilation. We have seen the same pattern in different areas a week apart, and there is no reason that in a few weeks it won't be the same everywhere. This is the pattern. 1, a few positive cases, first mild measures, people are told to avoid but still hang out in groups. Everyone says not to panic. 2, some moderate respiratory failures and a few severe ones that need tube, but regular access to ED is significantly reduced, so everything looks great. 3, tons of patients with moderate respiratory failure that over time deteriorate to saturate ICUs first, then NIVs, then CPAP hoods, then even oxygen. 4, staff get sick, so it gets difficult to cover for shifts. Mortality spikes also from other causes that can't be treated properly, end quote. Again, caveat on that because it's secondhand information. But Italy had confirmed 62 cases on February 22nd. It had 888 cases by February 29th, above the number the U.S. is reporting right now. And that was a week and a half ago. There are currently over 9,000 cases in Italy and almost 500 deaths. Let's hope that Italy is not merely a week and a half ahead of what other places might expect. It takes approximately 5 days for people to start showing the symptoms of coronavirus, a new study published in the Annals of Internal Medicine has found. The U.S.-based team studied 181 confirmed cases reported in January and February and found that COVID-19 has a similar incubation period as SARS. Quoting from the BBC, most people who develop symptoms do so on or around day 5. Quote, anyone who is symptom-free by day 12 is unlikely to get symptoms, but they may still be infectious carriers. The researchers advise people who could be infectious, whether they have symptoms or not, to self-isolate for 14 days to avoid spreading it to others, end quote. Taken together, the study's authors said that the statistics indicate that only 1 in 100 cases would go on to develop symptoms after the 14-day period, noting that this supports current U.S. guidance for the length of quarantine or active monitoring of people potentially exposed to coronavirus. The authors went on to suggest that, quote, although it is essential to weigh the costs of extending active monitoring or quarantine against the potential or perceived costs of failing to identify a symptomatic case, there may be high-risk scenarios, for example, a healthcare worker who cared for a COVID-19 patient while not wearing personal protective equipment, where it could be prudent to extend the period of active monitoring, end quote. We've all seen the stories about how hand sanitizer and antibacterial soap has been sold out seemingly everywhere in the U.S. In what I thought initially was a joke, New York Governor Andrew Cuomo announced yesterday that his state would be producing its own hand sanitizer to be distributed to citizens as needed. But I want to point you to a fact that I've seen brought up in several places over the last few days. It turns out that good old-fashioned soap, regular non-antibacterial soap, is actually pretty darn good against the virus. If you have soap, just use it. The final link in the show notes is to a tweet storm from Polly Thoroddsen, a chemistry professor from the University of New South Wales in Australia. It's very science-y, especially in the second half, and very chemistry-y. But this is the first half of it, the gist of it. Quote, why does soap work so well on the coronavirus, and indeed most viruses? Because it is a self-assembled nanoparticle in which the weakest link is the lipid. the fatty bilayer. The soap dissolves the fat membrane, and the virus falls apart like a house of cards and dies, or rather we should say it becomes inactive, as viruses aren't really alive. Viruses can be active outside the body for hours, even days. Disinfectants or liquids, wipes, gels, and creams containing alcohol and soap have a similar effect, but are not really quite as good as normal soap. Apart from the alcohol and soap, the antibacterial agents in these products don't affect the virus structure much at all. Consequently, many antibacterial products are basically just an expensive version of soap in terms of how they act on viruses. Soap is the best, but alcohol wipes are good when soap is not practical or handy, e.g., office receptions, end quote. He then goes on to explain the chemistry behind it, but again, the message is clear. Soap is fine. Soap is great. Just wash your hands. Hey, can I ask you to do the thing that all podcasts ask you to do at some point? Please rate and review this show. Please especially rate and review us on Apple Podcasts/iTunes, but really, wherever you can rate and review this show, please do that. Whatever podcast app you're listening to right now, see if it has ratings. It really helps other people discover what we're doing here. And hey, you could also tell your friends the next time COVID-19 comes up in conversation. If this show is useful to you, tell folks it might be useful to them as well. The Coronavirus Daily Briefing is produced by Ride Home Media. Today's show was written by myself and James Welsh. Be well, everybody. Talk to you tomorrow.